Hi everyone, I'm Rhea Joy Buado, your Data Privacy Officer. I will be discussing the data privacy and protection of Lorma Medical Center. Our objective is to develop the knowledge, awareness, and practices needed to apply during the course of employment. So first, let us define what privacy is. Privacy is the right to be let alone. And there are three types of privacy. First, locational or situational privacy. It refers to the privacy that is felt in physical space, such as that which may be violated by trespass and unwarranted search and seizure. Second, decisional privacy. It involves the right to independence in making certain important decisions. And the third one, which is the focus of our discussion, the informational privacy. It is to deprive an individual of his power to control or determine whom to share information of his personal details would deny him of his right to his own personhood. There are two aspects of information privacy: the right not to have private information disclosed and the right to live freely without surveillance and intrusion. Data is the new oil of the digital economy. And because of this, the government mandated the National Privacy Commission to administer and implement the Data Privacy Act 2012. What is the Data Privacy Act of 2012? It is a law that seeks to protect all forms of information, be it private, personal, or sensitive. It is meant to cover both natural and juridical persons involved in the processing of personal data. Data privacy encompasses the rights of individuals and obligations of organizations. Here in LORMA, data privacy encompasses the rights of our patients and our obligation to protect their data. So what does the law regulate? It is the processing of personal data. Processing refers to any operation or any set of operations performed upon personal data, including but not limited to the collection, recording, organization, storage, updating or modification, retrieval, consultation, use, consolidation, blocking, erasure, or destruction of data. What does the law protect? It is the personal data. Personal data is any information, whether recorded in a material form or not, from which the identity of an individual is apparent or can be reasonably and directly ascertained by the entity holding the information, or when put together with other information would directly and certainly identify an individual. An example of personal data is the patient health record. It is where you can see the name of the patient, the admission number, the age, the birthday, the address, the diagnosis, the lab results, x-ray results, etc., etc. And there are two types of personal data: the personal information and the sensitive personal information. What we are holding and processing in LORMA is sensitive personal information. Data subjects. Data subjects are those individuals whose personal data are processed. Here in LORMA, our data subjects are our patients. And these are the three data privacy principles. First, transparency. Transparency wherein data subject must be aware of the nature, purpose, and extent of the processing of his or her personal data, his or her rights, and how this can be exercised. So our patients must be informed why are we collecting their information, who will access it, who will process it, etc., etc. We should be transparent every time to our patients. Another, legitimate. It means that processing of information shall be compatible with a declared and specified purpose, which must not be contrary to law, morals, or public policy. And the third one, proportionality. Processing of information shall be adequate, relevant, suitable, necessary, and not excessive in relation to a declared and specified purpose. So kung ano lang yung kailangan nating i-collect from our patients, yun lang yung kailangan nating kunin. Hindi tayo pwedeng kumuha ng mga information na hindi naman connected sa kanilang medical treatment. These are the rights of the data subjects: right to be informed, right to object, right to access, right to rectify, right to erasure or blocking, right to damages, right to data portability, and right to file a complaint. First, right to be informed. Every patient has a right to a clear, truthful, and substantial explanation in a manner and language understandable to the patient of all proposed procedures, including the use, disclosure, and privacy of his or her protected health information. Ito yung sinasabi ko kanina. We should be transparent to our patients kung saan natin ginagamit yung information nila. Second, right to object. Patients shall have the right to object to the processing of his or her protected health information, including the access of processing for direct marketing, automated processing, or profiling. So may karapatan si patient na mag-object na huwag gamitin yung information nila sa mga bagay na outside medical treatment na, like for example, yung magmamarket tayo through Facebook, ganyan. Kung ayaw naman ni patient na gamitin natin yung mukha niya or yung information niya or yung story niya, hindi tayo pwedeng mag-process nun. So, may karapatan si patient na mag-object na hindi natin gamitin yung information niya or kahit yung picture lang niya. Next, right to access. Patients shall have the right to access and obtain a copy of their protected health information in an electronic or structured format and on how their personal data and health information is used. Lorma Medical Center shall ensure that disclosures and any subsequent changes are in accordance with the law and are properly documented. May karapatan si patient na humingi ng or mag-request ng kanyang health information. Of course, lalo na kung si mismong patient yung humihingi, di ba? Okay, for the right to access, for minors, either parent or a legal guardian have access to the child's protected health information. Access requested by a family member, aside from parents and or representative, will be reviewed and will generally be approved unless there are legal or medical reasons to deny the request. And for the incapacitated and deceased patients, a duly authorized representative may access the protected health information at any time after death of the patient or when the patient is incapacitated or incapable. So sa mga bata, si parent ang pwedeng kumuha or mag-request ng information ng anak nila or yung guardian, legal guardian. And for the incapacitated naman or incapable or yung mga pasyente nang namatay, si authorized representative lang or the nearest kin ang pwedeng mag-request ng information or mag-access ng information ng pasyente. Another right to rectify. Consenting patients are entitled to request alteration or correction of protected health information to ensure it is accurate, up-to-date, and not misleading. If the protected health information has been corrected, the duly authorized staff shall ensure the accessibility of both the new and retracted information. Another, right to erasure or blocking and damages. Patients shall have the right to suspend, withdraw, or order the blocking, removal, or destruction of his or her protected health information, and shall be indemnified for any damages if Lorma Medical Center unlawfully obtained and used unauthorized of their protected health information. So, kung ginamit natin ng hindi natin pinapaalam sa pasyente, or we use it unauthorized or unlawfully of their health record or their information, our patients have the right to suspend, withdraw, or order the blocking or removal or destruction of their information. Or pwede silang magreklamo. They can file a complaint to us. Another right to data portability. Protected health information is processed by electronic means and in a structured and commonly used format. Consenting patients have the right to obtain protected health information in the patient portal. If you are already aware of our patient portal, yun sa MedSys, nakikita yun sa MedSys, patient portal, ma-access mo yung information mo doon. Like for example, lab result, x-ray result, parang may ilalagay ka lang na number doon. I think it's the receipt number or something, admission number or what. And then you can already access your x-ray result, laboratory result. I'm not sure with the other services, but I'm sure that you can already access those two kinds of results, the x-ray and laboratory. Right to file a complaint. If patient's personal data or protected health information has been breached, a privacy complaint is an objection to the way a person's personal data has been handled. For example, inappropriately disclosed to other people. So ano ba yung breach na sinasabi natin? Ano ba itong breach? Breach is the unauthorized or impermissible acquisition, access, use, or disclosure of personal data and health information of patients. And there are 3 types of data breach. First, the availability breach is due to loss, accidental, or unlawful destruction of personal data. Second, integrity breach due to alteration of personal data. Ayan, swapping of medical records. Third, the confidentiality breach due to unauthorized disclosure or of access to personal data. Example, hacking, theft, spying, scheming, and phishing. These are the most common types of data breaches in a hospital setting. First, the cybercrime hacking, the clicking on malicious link that will lead to drive-by download of malware. You should be careful in browsing your internet, lalo na kapag ginagamit nyo yung computer sa mga station nyo or sa computer nyo sa workplace kasi hindi nyo alam, baka hindi pala safe yung binivisit yung website. Please always be careful in visiting sites. Kailangan yung i-check kung yung link ba is may padlock. Nakikita niyo ba yun? Yung sa kung magsa-search kayo dun sa search bar and then you click it. Then kapag mag-visit ka ng site, makikita mo may padlock doon. Kapag may padlock sa tabi ng site, that is safe. Pero kung hindi, huwag nyo na lang pasukin yung website kasi yung mga ganong sites, may mga sila virus wherein hindi mo namamalayan, may biglang nag-download or auto-download na file, tapos yun pala virus. Another, loss or theft of mobile device or media, especially if it's owned by the company or institution. Company laptops, company phones, yung mga company phones, yung mga cellphone numbers doon ng doctors, it is considered as personal information. So kapag nawala ang company phone, that is already a data breach. For the company laptops naman, kapag yung laptop is merong system, yung MedSys naka-install doon sa laptop, tapos nawala yung laptop, pwede siyang ma-access or ma-open ng kung sino man ang nakakuha ng laptop. Another, insider accidents or workarounds, the unauthorized access in workplace. Fourth, malicious insider or fraud. Medical claims fraud, where a worker files dishonest healthcare claims in order to turn a profit or sell sensitive personal information. Okay, another, insider snooping. A patient is not under the direct care of the worker. For example, you are nurse A from 3A station, and then you access patients or at least a patient record from another station. That is insider snooping. So hindi dapat ganon, bawal yun. Kasi dapat kung ano lang yung pwede mong i-access sa station mo. And I believe that if you are appointed to a certain station, if you are in 3A, for example, the only records of patients you will see should be the patients of that station only. So if you will access patients from another station, that is considered breach. Another, improper disposal. Yung ang dami-daming papel o kaya ang kalat-kalat sa work area mo, and then magfa 5S ka, tapos tapon ka lang ng tapon sa basurahan, hindi mo tinitignan, may personal data na pala doon. So that is improper disposal. So kung meron namang shredder, you have to shred the papers which contains personal data. Pero kung wala, pwede mo naman siyang punit-punitin na lang. Another, employee negligence. Actually, this is the number one, employee negligence or human error. Okay, another, the unauthorized posting of personal data of patients in social media, including pictures, unprofessional behavior or misinformation witnessed in social media that violates patient privacy or privacy of other individuals shall be reported to appropriate authorities. So please refrain from posting, sharing, or using photos or videos taken within the facility. That will violate their right to privacy. Lalo na kung walang paalam si patient, na binibidyo mo pala siya. Or nagpo-post ka sa Facebook, or whatever social media platform is, bawal yon without the consent of the patient. So what if data has been breached? Personal data security accidents shall be reported promptly and responded to in a quick, effective, and orderly manner in order to reduce the negative effect of data breaches, to repair damage, and mitigate future risks. So ito po yung personal data security breach report form natin. Kapag nagkaroon ng breach, kapag nagka-breach ka, or kahit hindi ka nagka-breach, please report it immediately to your immediate supervisor, to your department head, or to the customer experience officer, si Ma'am Cecil, o kaya kay Ma'am Terry, or sa HR, or pwede namang directly sa akin. Kung hindi ikaw yung nagka-breach, pwede mo namang isumbong kung sino man yung nagka-breach, but you don't have to be scared kasi pwede mo namang sabihin sa akin na wag ko nang ilagay kung sino yung reporter. So that is okay. Ito yung form, and then ang nilalaman ng form is the date of breach, kailan nagkaroon ng breach, kailan na-discover yung incident, sino yung reporter, or kung ayaw mo talaga ilagay kung sino yung reporter, pwede namang ako na lang. The incident details, how many data subjects were affected, and the brief description of personal data security breach, and the brief description of any action since breach was discovered. And these are the crimes against the Data Privacy Act law. The crimes are both, the penalties are both imprisonment and fine. So hindi ka lang makukulong, magbabayad ka pa. But you don't have to be nervous or scared agad kasi hindi ka naman agad-agad parang ide-demanda kasi as much as possible data breaches will be parang aayusin muna dito within the hospital para hindi na tayo aabot sa National Privacy Commission. So with that, what are our obligations. Lorma Medical Center Inc. is committed to safeguarding the privacy of personal data of patients as well as employee records and has implemented measures to comply with legal obligations with the Data Privacy Act 2012. We are bound by a strict code of conduct to maintain confidentiality of all personal and health information which we access in the course of our duties. So it is required to preserve and protect the confidentiality and security of patients' personal data. These are the important notes. Please take note. We may only access patient and employee personal data where this is required in the course of our employment. Disciplinary action may be imposed if we are found to be in breach of patient and employee privacy. We must not, other than in the course of our employment, intentionally disclose or use any personal data about an individual to which the staff member has access in the exercise of his or her official functions. We should not disclose patient information without entrusted authority, authorization from a supervisor, or without patient consent. So care must be taken when collecting and storing personal and sensitive personal information on the system, including USB and so on. Also, programmers and IT support are responsible for implementing appropriate privacy and security processes. For the collection of personal data, personal and sensitive personal information must be collected directly from the patient, unless unreasonable or impracticable to do so. The information collected must be relevant, up-to-date, and accurate. It is important to inform the patient about how the information may be used and who may access it and to whom it will be disclosed. The collection of information shall start at the time of registration and shall be obtained by authorized personnel and will be carried out in the admitting or registration section. Subsequent collection of information shall be undertaken at different points of the care provided to the patient. Next, the storage, security, and disposal. Personal data must be stored securely and hard copy information must be disposed appropriately at all times using shredder. It should never be put into unlocked bins, public trash bins, or used as scrap paper. In hard copy and electronic formats, personal data should be protected from unauthorized access, use, or disclosure. Records, especially health records, and computer screens should not be accessible to unauthorized people. Printers and fax machines should be located in secure staff areas. Caution should be exercised when discussing patient or even employee details via telephone, email, and social media to ensure the caller has legitimate grounds to access the information provided. We should ensure patient and employee privacy is not breached if discussing personal and sensitive personal information in public areas. Access, amendment, and accuracy. Patients or their authorized representative can apply for access to their personal and sensitive personal information. Some departments may have a procedure in place where sensitive information is accessed with the doctor in the first instance. Staff should consider whether this is necessary before granting access. Patients are entitled to request alteration or correction of their personal data to ensure it is accurate, up-to-date, and not misleading. Attachment of information provided by the patient is also permitted. So doctors and members of the allied health profession may review a patient's information if they are presently involved in the patient's care. And consultants shall have access to records of patients referred to them. Third, or the last one I should say, the consent. A duly authorized staff must always obtain consent from the patient and employees who own the personal data before releasing personal and or sensitive personal information. Consent for disclosure of personal data should be provided in writing if the person requesting is acting on behalf of someone. Uses and disclosure. It is necessary to obtain patient and employee consent to disclose personal data. If it is for the statutory reporting to government agencies such as DOH and PhilHealth for reporting Medicare details, notifiable diseases, births and deaths. To comply with a subpoena, summons or search warrant, investigation and complaint report, and managing legal action brought by the patient against Lorma Medical Center. For purposes related to the operation of Lorma Medical Services, of course, for planning, financial or management purposes, research, staff training, and conducting safety and quality improvement. Contact patients and employees regarding satisfaction surveys that evaluate and improve services. And to other health services and authorized parties to help prevent a serious threat to someone's life, health or welfare, or in an emergency, especially now that it's a pandemic. Since it's pandemic, and if you are one of the close contact of a COVID positive, hindi na kailangan humingi ni contact tracer sa COVID positive ng consent para sabihin sa close contact mo na si ganito is positive. Hindi na kailangan ng consent kasi it's for the it's to prevent a serious threat to someone's life. Tsaka it's an emergency. The National Privacy Commission also clarified that contact tracing or the Data Privacy Act is not a hindrance in contact tracing. So these are the key takeaways. Employees should only view a patient's information if they are involved in the patient's care and need the information to do their job. Health information should never be left in open view where can casually view it. Employees should be aware of the volume of their voices when speaking about a patient's health information. Employees should use automatic screensavers, lock their screens or log off when leaving their workspaces, and place paper documents upside down or in a drawer if possible. Never discuss patients outside of work, of course. Never discuss patients with other co-workers who are not involved in the patient's care. The only time a patient should be the topic of conversation is when the patient's information is being used for an approved purpose. Do not share or let others use their login and password information. Each of us has our unique or own MedSys account. So please do not share your username, your password, kasi kapag ginamit ng iba yung MedSys account mo, tapos nagkaroon ng breach, sila yung nagka-breach, pero ang ginamit na account is yung account mo. Ikaw yung liable, ikaw yung accountable for that breach kasi account mo yun and it reflects on our database na yung account mo ang nagamit or yung pangalan mo yung nandoon. Or kung nag-print pa ng information or let's say clinical abstract, yung pangalan mo ang magre-reflect doon. So please do not share your MedSys account, your usernames and passwords kasi nangyari na yan before. Nagkaroon na ng breach by using other account, a MedSys account, and then ang liable, yung may-ari ng MedSys account na yun, kahit hindi siya yung nagka-breach. So please, wag tayong mag-share. Okay, another. Never disable antivirus software. Never install software on a work computer or laptop without prior approval. Never open suspicious emails. Report any privacy or security violations or suspected violations. And staff members should put themselves in the patient's place and treat the patient's protected health information as they would want theirs to be treated. So that's the end of our presentation, our discussion. I hope you have learned something, and if you have concerns or for future concerns, don't hesitate to call me at local 122 or email me at reajoy.buado@lorma.edu. Thank you.